Hi guys, so this is Dr. Maimoona. The topic today we'll be talking about a little bit is about PCO, polycystic ovaries. We know a lot about polycystic ovaries in different ways, but I just want to inform you a little bit in detail that what exactly is the issue, because usually patients think that our ovaries are not working, because of which we are gaining weight or we are getting all the problem of hair and all that. So let's go and talk about it. I'm going to let you see a little bit what is polycystic ovary. Almost 10 to 20% of all women around the world will suffer from polycystic ovaries, okay? It is not only reproductive age related, it may come even at old age or younger girls, all right? Now, normally in normal ovaries, you have some eggs and which are formed and they rupture and then there's ovulation, okay? But in polycystic ovaries, you will find that instead of eggs, there is multiple small tiny cysts and which do not let the big egg form, and because of that, there is no ovulation. This is why we think that, okay, there's some ovarian problem. Our ovaries are hurt, okay? And we think that the syndrome is basically related to ovaries. This is a wrong concept because the main problem is not the ovaries, it's the male hormone. Now, male hormone, which is androgens, that can be secreted not only by the ovaries, but it can be by the adrenal glands and also from the fat cells. So if we understand the concept of this, that whenever we say obese women or fat women have more chances of PCO is because the fat cells are more prone to make male hormone, okay? Now, this male hormone, which is testosterone, it gets high, which leads to polycystic ovaries. So it's not the other way around that the polycystic ovaries will cause the male hormone to go high. That's wrong, okay? Whenever you have polycystic ovaries with the symptoms together, you end up having the polycystic ovarian syndrome, not just the polycystic ovaries. When you only have ovaries, you may not have symptoms, that's not worrying. But when you have polycystic ovaries with the symptoms, that is the main problem. Now, what are the symptoms you commonly experience is irregular menstrual cycle. You may experience increased body hair growth, some acne, which is very depressing, and also infertility issues. These are the main short-term issues. Now, what do? Obviously, it's the person is worried, and some patient may have issues with periods, someone with infertility, and giving them a lot of depression. Now, polycystic ovaries is, as I said, not only short-term. The lifelong problems are there which are related to metabolic condition. When we talk about metabolic, usually it ends up in all the hormones related, for example, diabetes, hypertension, heart problem, even sleep apnea. Sleep apnea means when you're sleeping, you're not able to get full oxygen because of the heavy weight. So all these have been related to polycystic ovarian syndrome. Now, what are the issues? As I told you, it increases the risk of obesity, diabetes, fatty liver, high blood pressures, and finally heart diseases. All of this is because of the raised level of androgens, and that increases the risk of all these things. Now, in summary, when we talk about PCOS, it's a serious metabolic condition. It is driven by excessive androgens, and it is characterized by abnormal symptoms, which is irregular cycles, your acne, your hirsutism, that means excessive male hormone, and infertility, not able to get pregnant. And finally, there may be cysts in the ovaries. So that's all. Now, when you're getting treated for your polycystic ovaries, remember that you may be not only going to one person, you may have to do multidisciplinary approach. That means follow a lot of doctors. Maybe GP, maybe nutritionist, physiologist, a gynecologist, a psychologist, an endocrinologist, or weight management specialist. So multiple people are involved in that. And then finally, you make a treatment plan with each other. I hope it helped you, and I hope that from now on you're more understanding the situation, that it's not the ovaries which cause the problem, it's basically the male hormone. So visit your doctor as soon as possible if you're experiencing any of those symptoms. I hope that you were able to understand a little bit about polycystic ovaries. There's one very important thing I will tell you, that there are different things, weight management, there are different food to eat in PCO, there are different exercises which help. Also, there's one seed cycle. You can use the seeds, different chia seeds and all flax seeds, in a proper way to stimulate your estrogen progesterone. All these are supportive, but they are not the final treatment. Especially the patients who are more obese. It's not a disease of only obesity, but if you do have obesity, remember the main plan of management is around your weight management, because the extra fat is making the androgens. Once you cut down on your weight, almost 15% of your body weight, your body starts working well, and your ovaries start ovulating. So I wish you all the luck, and I hope this helped you a lot. Thank you so much. Happy PCO month.